Augmentin contains the active ingredient amoxicillin clavulanic acid. It's a combination penicillin-type antibiotic used to treat a wide variety of bacterial infections. It works by stopping the growth of bacteria. This antibiotic treats only bacterial infections. It will not work for viral infections, such as common cold, flu. Using an antibiotic when it is not needed can cause it to not work for future infections. Indications. Augmentin is used to treat the symptoms of many different infections caused by bacteria, such as lower respiratory tract infections, chronic obstructive pulmonary disease, bacterial sinusitis, animal-human bite wounds, and skin infections. Augmentin may be used alone or with other medications. How to use. Augmentin may be taken without regard to meals. However, absorption of clavulanic potassium is enhanced when augmentin is administered at the start of a meal. Adults. The usual adult dose is 1 500 mg tablet of augmentin every 12 hours, or 1 250 mg tablet of augmentin every 8 hours. For more severe infections and infections of the respiratory tract, the dose should be 1 875 mg tablet of augmentin every 12 hours, or 1 500 mg tablet of augmentin every 8 hours. Adults who have difficult swallowing may be given the 125 mg 5 ml or 250 mg 5 ml suspension in place of the 500 mg tablet. The 200 mg 5 ml suspension or the 400 mg 5 ml suspension may be used in place of the 875 mg tablet. Two 250 mg tablets of augmentin should not be substituted for one 500 mg tablets of augmentin. Since both the 250 mg and 500 mg tablets of augmentin contain the same amount of clavulanic acid, 125 mg of the potassium salt. Two 250 mg tablets are not equivalent to one 500 mg tablet of augmentin. The 250 mg tablet of augmentin and the 250 mg chewable tablet should not be substituted for each other, as they are not interchangeable. The 250 mg tablet of augmentin and the 250 mg chewable tablet do not contain the same amount of clavulanic acid as the potassium salt. The 250 mg tablet of augmentin contains 125 mg of clavulanic acid, whereas the 250 mg chewable tablet contains 64.5 mg of clavulanic acid. Pediatric patients. Based on the amoxicillin component, augmentin should be dosed as follows. Neonates and infants aged less than 12 weeks. The recommended dose of augmentin is 30 mg per kilogram per day, divided every 12 hours, based on the amoxicillin component. Experience with the 200 mg 5 ml formulation in this age group is limited, and thus use of the 125 mg 5 ml oral suspension is recommended. Patients aged 12 weeks and older. The every 12-hour regimen is recommended as it is associated with significantly less diarrhea. However, the every 12-hour suspension and chewable tablets contain aspartame and should not be used by fetal ketonurics. Contraindications. Augmentin is contraindicated in patients with a history of serious hypersensitivity reactions, e.g. anaphylaxis or Stevens-Johnson syndrome to amoxicillin, clavulanate, or to other beta-lactam antibacterial drugs, e.g. penicillins and cephalosporins. Augmentin is contraindicated in patients with a previous history of cholestatic jaundice, hepatic dysfunction associated with augmentin. Special warnings and precautions for use. Avoid taking this medicine together with or just after eating a high-fat meal. This will make it harder for your body to absorb the medication. Antibiotic medicines can cause diarrhea, which may be a sign of a new infection. If you have diarrhea that is watery or bloody, call a doctor before using anti-diarrhea medicine. Concomitant use of allopurinol during treatment with amoxicillin can increase the likelihood of allergic skin reactions. Prolonged use may occasionally result in overgrowth of non-susceptible organisms. In patients with renal impairment, the dose should be adjusted according to the degree of impairment. Augmentin side effects. Get emergency medical help if you have signs of an allergic reaction to augmentin, hives, difficulty breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Stop using augmentin and seek medical treatment if you have a serious drug reaction that can affect many parts of your body. Symptoms may include skin rash, fever, swelling glands, muscle aches, severe weakness, unusual bruising, or yellowing of the skin or eyes. Call a doctor at once if you have severe stomach pain, diarrhea that is watery or bloody, even if it occurs months after your last dose. Pale or yellowed skin, dark colored urine, fever, confusion or weakness, loss of appetite, upper stomach pain, little or no urination, easy bruising or bleeding. Common augmentin side effects may include nausea, vomiting, diarrhea, rash, itching, vaginal itching or discharge, or diaper rash.